20 years ago, CareFlight came to the NT on a mission to bring an aeromedical jet to Darwin and mark the beginning of a partnership with the community that would last a generation. We didn't just fly in and out, we live here, work here, and brought up our families here. What was originally a service to help Australians overseas immediately became even more vital to the top end when it quickly started filling a need to transport Territorians to interstate hospitals for advanced clinical care. The Territory always has a way of throwing a curveball. Like in 2008, when the Katherine runway was so overrun with wallabies that planes couldn't land, the team worked alongside the government to adapt and respond by making a helicopter available to ensure patients could get the care they needed. It's easy to forget that this emergency helicopter service was the first of its kind in the top end. The crews quickly found themselves busy helping people across the top end, reaching people in places that fixed-wing aircraft simply couldn't access. At night, out at sea, and through some of the most rugged country in the Territory, the rescue helicopter made it possible to get help where it was needed most. Before long, it had become an essential service for Territorians and a welcome sound for anyone needing help out bush.
From the first moment we get a phone call, the team turns on, to the moment when we know that they're on the ground and that patient is receiving the very best care that they possibly can, alongside the community members and the healthcare workers on site. That is an extraordinary experience.
Our service continued to grow in step with the needs of the community. The top-end medical retrieval service now reaches dozens of patients every single day. We even established a permanent base in Nhulunbuy to better reach patients across the remote communities of Arnhem Land. As the years passed, CareFlight became not only the Territory's own world-leading aeromedical service, but so much more. We began teaching trauma care in the most remote corners of the NT, upskilling local volunteers and community leaders so they could provide life-saving care in the critical first moments before help arrives. We grew our own too. We maintain our aircraft right here in the NT, creating local jobs and training young engineers to keep these vital aircraft in the sky. We continue to work alongside First Nations health services and communities to help break down barriers to understanding, using groundbreaking in-language resources. We've upskilled remote clinic workers and provided First Nations employment pathways. We aren't just serving remote communities, we've become a part of closing the gap.
CareFlight does not work in isolation in the Northern Territory. We work alongside NT Health, we work alongside the community-controlled Aboriginal corporations who provide amazing clinics throughout the top end of the Northern Territory. Between all of us, we come together and we provide the best possible care for Territorians day in, day out. We are so proud to be part of that. If I could go back to day one, I just couldn't believe what we've achieved over so many years. Not just our retrievals, but our footprint in the communities with our education, our commitment to all Territorians, to everyone who's been part of CareFlight in the last 20 years. Hundreds of people have been part of the journey that we've been on. I want to say thank you.
When people think of CareFlight, they usually think of helicopters, but the real story is the people. It's the nurses, midwives, doctors, pilots, engineers, support team, volunteers and donors who all play a vital role in achieving the best outcomes for patients. Whether it's a friend, a family member, or themselves, it's hard to find a Territorian whose life hasn't been touched by CareFlight. We've advocated for better coverage, an additional helicopter and jet, because the Territory deserves nothing less. We are immensely proud of the tireless work of our crews and our team over the past 20 years in making CareFlight what it is today. We will continue to serve Territorians, save lives and speed recovery into the future.